1,000+ members of the Vermont Medical Society, the American Academy of Pediatrics Vermont Chapter, the Vermont Academy of Family Physicians, Fletcher Allen Healthcare, and the Vermont Association of Hospitals and Health Systems. I'm joined this morning by a number of concerned Vermonters who have a common goal: ensuring the safety, well-being, and healthy future of Vermont's children. You'll be hearing today from physicians, experts in the fields of pediatric medicine and infectious disease, as well as healthcare public policy experts and legislators, all of whom hold protecting Vermont's children from death and disease near and dear to their hearts. As the House Healthcare Committee hears testimony on S-199, our purpose here today is simple. We'd like to lend reason, scientific rigor, and decades of groundbreaking medical advances to Vermont's immunization debate. This morning, we'll hear from Senator Kevin Mullen, Representative George Till, Dr. Robert McCauley, Dr. William Raska, and the President of the Vermont Association of Hospitals and Health Systems, B. Grouse. It is my pleasure to introduce our first speaker. Senator Kevin Mullen, since 1998, has represented the Rutland area in the Vermont General Assembly, first as a state representative, and from 2003 to present as a senator. The minority leader of the Vermont Senate, Senator Mullen is the vice chair of the Senate Committee on Health and Welfare and chair of Senate Education. And perhaps even more importantly, when it comes to why we are here today, Senator Mullen is the sponsor of S-199. Senator Mullen, thank you for your leadership on this very important issue.
Thank you, Stephanie. Thank you for the promotion. Just to set the record straight, I'm not the minority leader, I'm the assistant minority leader. But I'm very pleased today to join with members of the medical community to talk about a very, very important topic that we as society have not done a good enough job in the state of Vermont to make sure that people understand the benefits of vaccines and the overall positive good for the public health. So I really don't plan on saying a lot this morning. I'd rather have the doctors and the hospitals speak. But I will say that parents who bring their children to schools or to licensed child care providers should be able to do so with the ability to go home at night knowing that their child is safe and that they aren't going to be exposed to dangerous diseases. And this bill is all about protecting the public safety and the public health and ensuring that Vermont continues to be at the top of the charts nationally as being a leader in healthcare and a leader in protecting kids. So with that, I'll turn it back to Stephanie.
Our next speaker has a very unique perspective on the intersection of public health and policy. By day, George Till, MD, is a member of the Vermont House of Representatives. By night, he's a hospitalist at Fletcher Allen Healthcare, who, prior to his election to the House in 2008, was part of a group practice in Chittenden County for 21 years. The way Dr. Till became involved in politics, after battling the state to allow a youth lacrosse field to be built, tells you a lot about where his heart is. Dr. Till is also sponsor of an almost identical bill in the House. We are honored to be joined today by Representative George Till.
Thank you, Stephanie. Thank you, Senator Mullen. S-199 at its core is about safety in our schools and about public health in general. Parents have an expectation of a safe environment when they send their children to schools. The tension here is between having a safe environment and a parent's right to not have their children immunized. The vaccines we're talking about for school are 5 vaccines before you start kindergarten and 1 that you receive at 7th grade. The vaccines are DTaP, which is diphtheria, tetanus, and pertussis. It is MMR, which is measles, mumps, and rubella, hepatitis B, polio, and varicella, or chickenpox. Between 2005 and 2010, for children entering kindergarten, we have data on 3 of these vaccines and the rates at which those children were immunized. In 2005, for the DTaP vaccine, there were 96.9% of entering kindergartners who were vaccinated. By 2011, that's gone down to 91.6%. For polio, in 2005, there were 96.3% of children entering kindergarten vaccinated. By 2011, down to 91.9%. For MMR, measles, mumps, and rubella, in 2005, it was 93.6%, and by 2011, down to 91.3%. In addition, we're talking about 2 other vaccines required for licensed daycare, that being Haemophilus influenza B and pneumococcus. Just knowing the total number of vaccinations doesn't tell the entire story, though, because there are pockets within the state where vaccine usage is much lower than the overall number would suggest. The primary reason vaccines are not used are because of what's called a philosophical exemption. Religious exemptions account for only 0.2% of children not being vaccinated, but the philosophical exemption statewide is at about 5.5%. And in a number of schools, it's over 6% of kids who are not vaccinated because of philosophical exemptions. Now, we speak a lot in this building about reducing healthcare costs. There is no more effective way to reduce healthcare costs than vaccinations, and let me give you one example. In 1996, varicella chickenpox vaccination was introduced. Before the introduction of chickenpox vaccination, yearly there were 4 million cases, 11,000 hospitalizations, 100 to 150 deaths in this country. After the introduction in 1996, medical costs and medical usage for varicella decreased 75%. By the time the second vaccine was added in 2006, the second dose of the same vaccine, those costs went down 90%. So if you want to reduce healthcare costs, and that's been very in the front of what we've been doing in the legislature over the last 3 years that I've been here, vaccines are the most cost-effective thing that we can do within the medical community, within the medical system, to reduce costs. The true science around vaccinations is quite clear. Vaccinations have dramatically reduced the incidence of devastating and lethal diseases. Those who would tell you that these diseases were being reduced before vaccinations and that other public health measures account for the reduction in these diseases need to explain to you how, over multiple different decades, other public health measures had that effect. The pertussis vaccine and the tetanus vaccine in the 1940s, polio in the late 50s, mumps and rubella in the late 60s and 70s, measles in the early 60s, Haemophilus influenza B and varicella in the 90s. What other public health measure was there in those 5 different decades that actually contributed to the reduction in these diseases? Each of these diseases fell after the vaccination was introduced, and those who would claim otherwise need to provide you with a mechanism. I have a handout, which I'll put on the table afterwards, which shows the date of introduction of the vaccine and the drop-off in the diseases that we're talking about. Vaccines, however, are not perfect. They do carry risks, as does every medical procedure. Vaccines are not 100% effective. Some who are vaccinated remain susceptible to the disease despite being fully vaccinated. Of course, no medical intervention that I know of is 100% successful. Some people say that the reason that vaccines not being 100% successful is a reason not to vaccinate. In my opinion, that's exactly why we need to vaccinate. People who have taken the risk of being vaccinated may still be susceptible to the disease. Some people will in fact be harmed by the vaccines, It's truly a tragedy when this happens. But many things are attributed to the vaccines, which the vaccine did not actually cause. The National Academy of Science, the Institute of Medicine, released a report in August of 2011. They took a very impartial approach to whether particular vaccines cause particular adverse reactions. Their summary report is here, and I will just read you a little bit of the very last sentence of the report, of their conclusions, assuming I can find it. Looks like I missed a page. I'll just have to paraphrase it. What they said was vaccines offer some of the best public health tools available to medicine, and that although there are complications of vaccines which need to be acknowledged, most of the adverse events reported in relation to vaccine are not caused by the vaccines. Now, I'll be the first to say that we don't know what we don't know. But what we do know is the data that we have right now says that in each and every case, these diseases we're talking about are more dangerous than the vaccines that are being offered to prevent the disease. And we also know that it is a true tragedy, not only when there's injury from vaccine, but it's a true tragedy when a vaccine-preventable disease injures or kills a child. Now, some people will tell you that we don't really need this legislation right now, that we don't have a crisis. A hospital CEO testified to House Healthcare yesterday that 2 weeks ago they saw a case of mumps in their emergency room. I haven't seen mumps in Vermont in a very long time. He testified that they saw a year ago a case of measles. We don't see much measles in Vermont. In the pediatric intensive care unit, very recently we had a case of Haemophilus influenza B, a very difficult and terrible course, a very, very sick child with a vaccine-preventable disease, a child who was not vaccinated. Yesterday, the Department of Health testified to us that in the first 3 months of this year, we've had 94 cases of pertussis in Vermont. That's more than we had in the entire year last year. Pertussis points out one of the real problems with the lack of vaccination. It's not just the school-age kids who are at risk, but the younger siblings at home. So even though a child is fully vaccinated, they still run a risk of contracting whooping cough or pertussis. If they bring that home to their younger sibling, it can be devastating. For children less than 2 who get 2 years of age who get pertussis, there's about a 69% chance that they will end up hospitalized. And 85% of the deaths related to pertussis happen in those less than 3 years of age. California had 10 deaths from pertussis in 2010, and 9 of those were in very young children. Some children in our schools just can't be vaccinated. They have medical reasons. They can't take the vaccine, some of the vaccines. They have allergic reactions to some of the vaccines. Some children and adults in our schools are at particular risk from these diseases. I want you to think of the younger siblings that I mentioned with the pertussis, pregnant women in their fetuses from rubella, measles, varicella, individuals receiving chemotherapy or radiation therapy. There are individuals with compromised immune systems, and those fall of their own in our schools. People with diabetes, people with other chronic diseases, people with HIV, children with cystic fibrosis. These folks are all at extreme risk from these diseases, which are vaccine preventable. We don't need to wait until we're in the middle of a crisis to act. The signs that we're headed for a crisis are there. As elected officials, we have the obligation to protect the public health. I hope sincerely that the House will follow the lead of the Senate and Senator Mullen and pass S-199 as it has been proposed. Thank you.
Thank you, Dr. Tillett. The immunization bill is one that deals with both ethics and medicine, so it is quite appropriate that we are joined today by Dr. Robert McCauley. Dr. McCauley is the Medical Director of Clinical Ethics, a palliative care physician at Fletcher Allen Healthcare, and a clinical associate professor at the University of Vermont College of Medicine. Dr. McCauley's work focuses on clinical ethics, pediatric palliative care, and spirituality. An Episcopal priest who holds master's degrees in philosophy and theology from Oxford and Yale, Dr. McCauley is also the father of 2 young children. Dr. McCauley, thank you for being here today.
I appreciate the opportunity to speak today on behalf of S-199, and I do so from 3 specific perspectives, as a pediatrician, as a father, and also as a bioethicist. As a pediatrician, I had the privilege of working at a hospital in East Africa before coming to Vermont. And I can remember early on in my time there when I saw a young child, about 3 years old, come in with high fever and a variety of other signs. And I looked at this child and I thought to myself, wow, that looks like measles. But it can't be measles, because I had never seen measles before. I had just read about them in textbooks. And then eventually it dawned on me that in fact it was measles, a vaccine-preventable disease that this child did not have the opportunity to avoid because of the lack of immunizations in that part of the world. And over the next few days, I watched this 3-year-old die in front of me. A completely senseless and avoidable death. In that part of the world, those things happen because of the lack of the ability to deliver immunizations, the lack of funding, the lack of access. In this country, we have funding, we have access, we have science, and things like that should never happen anywhere, and they should certainly not happen here. As a father, I would like to share a personal experience. I have 4 children, ages 9, 7, 5, and 1. They're all maximally immunized, as you might expect from the children of a pediatrician. And my 9-year-old daughter, who is here today, contracted pertussis, one of the cases that Dr. Till mentioned. She's one of that number. And the reason that she contracted pertussis, despite being fully immunized, is she happens to attend a school with an unusually high rate of unimmunized children. She recovered fine, eventually, but it was very difficult for her during that time. She missed things that were precious to her because she was quarantined. Our other kids also missed things that were precious to them because they were quarantined. And pertussis was treated to the point where she was no longer infectious and her health was no longer threatened. But there's an old saying about whooping cough that whether you get treated or not, you end up coughing for 100 days, and that was about right. And if anybody wants to talk about the impact of pertussis in a, granted, non-life-threatening situation, I'll talk about 100 nights of hearing my daughter cough over and over and over again. It was very difficult for us. But we dodged a bullet because she happened to catch it when she was 9, as opposed to when she was 8. Because if she had caught it when she was 8, then our youngest would not have been 14 months, she would have been 2 months. And she would have been too young to be immunized. And my daughter, fully immunized, my older daughter, would have unwittingly brought home a life-threatening infection to our youngest who could not be immunized. So I count myself fortunate that the timing worked out in a way that did not imperil my children further. Finally, as an ethicist, there's been a lot of talk in this debate about rights. There's been a lot of talk about freedom, and there's been a lot of talk about autonomy. Autonomy is a very precious thing in bioethics in our country. Sometimes that's all we talk about, is the right of people to make their own decisions. I'd like to underscore the fact that the people who are involved in this debate are not the ones making the decisions. The people who are put at risk don't have a voice in this because they're too young to have a voice. They don't get to make the choice. Their parents get to make the choice, Their parents get to make the choice based on the parents' own beliefs about what is in their child's best interests. The science is clear. Immunizations are not only in an individual's best interest, they're in the community's best interests. But we don't legislate that. We don't require people to do the right thing all the time. People have the freedom to make choices, even bad choices, when it comes to the health of themselves, certainly, and to some degree also their children. So, to be clear, this bill does not require parents to immunize their children. No children are going to be taken away from their parents and forced to be immunized. They have the freedom not to immunize in the face of compelling medical science. At the same time, though, parents who do choose to immunize, and especially the parents who cannot make that choice because their children are too young or suffer from diseases that do not permit it, they should also have the freedom to send their children to school knowing that they are safe. And in the midst of all this debate about rights, it's sad for me as a Vermonter and as an ethicist that what we're really talking about all the time is individual freedom, and what we're not talking about is the common good. And the common good, especially for the most vulnerable among us, is to maximize immunization rates to protect the children who cannot be immunized, or the children who have serious disease who are immunized, but the immunizations, like anything else in life, are not foolproof. So I stand in favor of S-199. I stand in favor of removing the philosophical exemption for the sake of the children who cannot be protected in any other way and should not be forced to go to school and exposed to life-threatening illnesses. Personal liberty is one thing. Parents should be free to make that choice. They shouldn't be free to expose other parents' children to the perils of infectious disease that is preventable. Thank you.